Thank you very much. Our fourth speaker is Laura Alfers, who is a researcher on the Social Protection Program of Women in Informal Employment, Globalizing, and Organizing. Laura?
Thank you. Good afternoon. In true WIEGO style, I'm going to take this panel right down to the grassroots again. We've been talking from the perspective of policymakers and academics. And I want to continue the focus on institutions, but I want to turn it around so that we're looking from the ground up at health institutions. I'm going to be talking particularly about work that we've done on an occupational health and safety for informal workers project that operated in 5 countries with a focus on Ghana. But I do want to make some comments about linkages to universal health coverage and to national health schemes. I'm going to be talking in particular about 2 small projects that WIEGO has run over the last 3 years with 2 of our partners in Ghana and South Africa. And they are very small projects. They're not on the scale of a SEWA or anything like that. But they do illustrate some of the bigger problems with the institutional setup of the health systems when it comes to covering informal workers. Just to give you a brief idea of the size and shape of the informal workforce. In Ghana and South Africa have 2 very different labor markets. Ghana has a much higher share of informal employment, over 90%, whereas South Africa sits around 33% of the workforce being informal. Still, both countries have significant numbers of streets and market traders. In India and Ghana in particular, it's a very important source of employment for women. Many of these traders are self-employed own account workers. They work for themselves and they don't employ others. And it's these workers, these street and market traders who I'm going to be focusing on today. And it's important to specify this because of their particular workplaces. They work in urban public spaces. And when you take the perspective of workers working in these particular spaces, there are very specific concerns around the setup of health systems. So in terms of health systems in general, the sort of move towards universal health coverage in both Ghana and South Africa has sort of resulted in a move towards national health insurance schemes. Ghana has the National Health Insurance Scheme, which has been running since 2003. In South Africa, as Barry told you, we do already have a free public health care system. However, the quality suffers, and we also have a very strong private healthcare system. So this national health insurance that's being proposed and is in a pilot form at the moment is sort of partly in place to address the imbalance between the private and the public sectors. So in Ghana, the National Health Insurance Scheme is quite well known now. It was an innovation on social health insurance, which includes a voluntary component for informal workers to insure themselves. We've done a small study on barriers to access to the scheme that informal workers face. We were invited by the Ghana Trades Union Congress to run the study. I won't go through it in too much detail. The policy brief is outside, which gives a summary of the problems informal workers face. I think one of the very interesting things that although the cost of the premiums was one issue, especially for the poorer workers, an even bigger issue was the administrative chaos on the ground and how long it took people to get registered. Most people we interviewed said, I'm actually too busy to spend my time running around trying to find a registration point where I don't know and might not be open at the right times for me. So that's very interesting. But now I would like to switch over to a different part of the health system, and that's really what gets left out in these health insurance schemes. These are pictures from Durban in South Africa from a market area called Warwick Junction, which I'll describe in more detail. The women on the bottom photograph are cooking corn on the cob in those tin drums that they'll be then taking to sell out on the streets later in the day. And the middle picture is from an area where the bovine head cooks cook their food. Bovine head meat is a speciality for Zulu people. As you can see, the conditions are not great that this work is taking place in. This is in Ghana. These are on the picture on the left-hand side is of a cooking spot where somebody's cooking food to sell to other traders. On the right-hand side is a blocked gutter, blocked drain, which is right next to the textiles section of Makola Market, which is one of the central markets in Accra. So some of the obvious problems you saw in those photographs can be put down to individual work processes, the use of certain types of fuel, and so on, and as the field of sort of, the ILO kind of interventions. But there is a huge problem there with the working environment itself. And so that's one of the key problems we come to, the key institutional problems, is that the regulation of informal workplaces, particularly ones that are in public spaces, comes down to municipalities. And health insurance schemes, I mean, the South African one is still up for debate, but definitely the Ghana health insurance scheme does not cover this sort of issue at all. And all of these places of work are hazardous to the health of the informal workers who work in them. And this is just a very simple diagram in a way that sort of elaborates the institutional problems that we face. And usually in the field of occupational health and safety, the key institutional problem is often described as that between the Ministry of Health and the Ministry of Labour. How can we get them to collaborate better? Who collaborates with the doctors? Who collaborates with the safety experts? But when we're dealing with informal workers working in urban public spaces, we have to add another layer of complexity to that, and that's the ministries of local government, and then beneath them, the municipalities, local government, and all the departments that make up those municipalities that have an impact on the health of informal workers, environmental health, waste management, urban infrastructure. And also need to mention that, as Marty pointed out yesterday, it's not just, say, benign neglect in terms of non-provision of basic services to informal workplaces like sanitation and water. It's that the municipal regulations can actively threaten the health and safety of workers through violent evictions, through confiscations of goods, through the mental stress that street traders and market traders go through on a daily basis, knowing that they are constantly under threat from municipal regulation. So that's some of the background to the interventions we designed. And the first one I want to talk about is what we call the Accra Health and Safety Platform. That was started in 2010. And I just wanted to elaborate some of the basic principles. And these principles are WIEGO-wide principles, and they're principles that have developed through SEWA and through many of our other informal worker organizations. There needs to be some kind of institutional reform in order to meet the needs of informal workers. But reforming institutions and regulations, as Sarah will tell you, is a very long and difficult process. And for us, the first step to reforming is to first build and sustain more positive relationships between those who are governed by the institutions and those who govern. And this can only be done when spaces are created where these relationships can be built in an even-handed manner. Quite often, you'll get the government coming to consult informal workers, but informal workers have no idea really about how to engage properly with the people they're meant to be engaging with. So you have a consultation, but it's very one-sided, and it's not fair. So we decided in the Accra program to specifically engage with municipal institutions as well as the occupational environmental health unit at the Ghana Health Services, just because the sort of basic conditions of work in the markets were so terrible. And so we got representatives from the Ghana Health Services, the Accra Metropolitan Assembly Fire Department. Market fires are also a massive problem. You know, often you'll have a fire in a market which will destroy 400 stalls. And those are lifelong businesses that have been destroyed, as well as waste management and environmental services from the municipality. And then we put worker organizations, our partners, StreetNet Ghana, put them through a long process of capacity building about how to engage in negotiations and in this platform with the government services, just so that they had a better chance of getting what they wanted out of the government, about how to articulate their demands, how to form a strategy. and just basically how to not end up in a screaming match with your local government officials. There are often very tense relationships between street traders and local governments. It's very necessary to bring the level down. So some of the commitments we got out of the local government in Accra after about a year of this process, one of the things traders were complaining about was that the privatized waste management companies were trying to get more money out of traders by dumping refuse next to their stalls and then asking for money so that they would pick it up later. And so one of the things that the municipality proposed was that perhaps the traders could form a surveillance team themselves and monitor the progress of the waste management committees, and they could then report back to the local government to help in the monitoring of these abuses. Were no fire extinguishers in Makola markets when legally there should be, because it's a publicly owned market. And the traders had themselves, because of their fears, paid for their own fire extinguishers by collecting money. But legally, this is a mandate of the local government, and so we wanted the local government to provide them. And then the third was the clearance of that drain you saw in the earlier picture, which is next to the textiles section. The smell was something that just drove away customers, and it's just not in a nice environment to work in. So what happened after we got those commitments? The waste management committees are still in the process of being formed, because that is a process we have to work through with the traders themselves. The fire extinguishers, the local government came around to site the extinguishers, but we haven't had any results further than that. There was a clearance of the drain, but actually the drain's problem is a structural problem and needs a much bigger fix than just to be cleared, because it's clogged again. So what we learned was that it doesn't just take one interaction. It takes many, many interactions on a constant basis. And that building these platforms is the first step to being able to have those kind of continuous relationships. So one of our goals is to try and institutionalize this platform, because formal workers have bargaining councils. They have platforms where they can communicate with employers and with government. Informal workers don't have those platforms, and we need to have them. Particularly at local government, when it's around sort of the basic health and safety of their working conditions. So that's now become a sort of goal for us in the health and safety program, is to try and start institutionalizing these platforms. Ideally, that would mean to have some kind of state mandate behind them. Okay, so that was Accra in 2010, 2011. So now I'm jumping forward to Durban, South Africa in 2014. And this is where a grant from the Rockefeller Foundation's Centennial Innovation Fund allowed us to start to take this idea and start elaborating on it a bit further in a context with more resources, and so we could go further. And this is an aerial view of where we work. This area is called Warwick Junction. It's in the inner city of Durban. And Warwick, the actual markets in Warwick Junction sort of are below and within the network of roads here. Warwick Junction is a transport hub. It's estimated that 450,000 people pass through here every day. And it's what we call a natural market. There's so many people passing through, they want to buy. It's a natural place for traders and vendors to come together. And there are about 6,000 to 8,000 traders operating in this area. After 1994, it was the site of a really exciting urban regeneration project, which used existing urban infrastructure to really accommodate the street traders in a way that allowed them to improve their working conditions quite significantly. Francie can tell you more about that. But since then, the relationship with the municipality has soured, and lack of basic services in the area is a really, really big problem. And as well as harassment from local government officials. So with our project, our Centennial Innovation Project, we launched with our project partners, Asiya Etafuleni, who are an NGO working in Warwick Junction. Asiya Etafuleni means bring it to the table in Zulu, so it's about negotiation. And we have formed what we call the Pepa Nathi platform. Pepa Nathi means to be safe with us in Zulu. And, I've lost my place. There we go. We really see the platform as a sort of basic institutional architectural framework in which we can embed a range of health interventions, including occupational health, public health, and urban health issues. At the center of the project is what we call the Pepenati Health and Risk Management Committee, and that's made up of 12 elected traders from each of the markets. Each market has its own association of traders, and they are trained now in basic first aid and fire safety. And then on this platform, we have also invited municipal officials, the local university occupational and environmental health department, as well as public health officials. And we constantly invite people onto, depending on who we interact with and who is interested in working with us. And really the point is to help us bridge the divides, to bridge the institutional divides that are in the health system between the national health services, the municipal health services, and even the labor department at times, and the need for occupational health, of course. So we've just run our first basic occupational health and safety training course with the help of the local university. And we need this institutional, the occupational health and safety stuff is important because it is about individual work processes and what the individual worker can do. But the individual worker can only do so much. They've already got a lot of stress in their lives just trying to keep themselves going. There has to be an institutional support to give them support in maintaining the health and the safety and health of their working environment. And this is what we see the Pepenati institutional infrastructure is providing. So what will happen as well is that the base organizations will also be able to report up to the platform that we have formed. And if there is advice or we need help with anything, we can draw on the resources of the platform and bring it down to the workers. We've also trying to be innovative with mobile technology as well, but we could always do with advice here because this isn't our speciality. We heard about the Ushahidi platform from Kenya, which is a way of digitally mapping anything really through mobile SMSs. And so we've just done so I'll show you some pictures. We've just done a risk management fire mapping in Warwick Junction. This is a picture of us on our fire mapping. We had the Metro Fire Department here and the Provincial Disaster Management Services agreed to be part of this mapping. And what we're going to do then is sort of map these on to create a digital map that can be continuously updated by the traders using SMS. I think what's quite interesting about this picture of the risk mapping is a story that just illustrates the importance of making linkages and of the people who make the linkages between informal workers in different parts of the health system. So here the Metro Fire Department came. When we first phoned the fire department and said, listen, we've got a project with informal workers, we'd like to do some stuff on fire safety, would you like to cooperate with us? They said, well, I don't know how you're going to do that, because we were asked to go into Warwick Junction and provide health fire training. And we set up a fire training and we sent out pamphlets and nobody came to our fire training. And then we went into the market and we went to the tables of individual traders and we tried to give them individual trading and they turned their backs on us. And so we would like to see you try, like basically. So we said, okay, that's fine, but we have very good links with the trader organizations. We know how to do this process. We know how to consult them. We know how to let them understand what the point of all of this is for, that ultimately it is for their safety, their health, and for improving their productivity ultimately. And when we had this mapping session, the reception of the Metro Fire Department, she was so surprised because she was giving out little talks to the traders about where you should store your gas canisters and so on. And they were like really happy to get the information. They weren't defensive. They weren't angry. And she couldn't believe how different the reaction she'd got from the traders had been. So that's just an important way of saying that there needs to be proper participation of the workers right from the start, and then you can start building these kinds of relationships. But if that isn't there, if it's just sort of imposed from the top, it just doesn't work. The great thing about the platform, though, is that we've also used it in the past, especially in Accra, to link traders to the national health systems as well, right? So it's not just about the municipal institutions that we're working with. And the precedent for this was set in Ghana. We had, again, funding from Rockefeller Foundation in 2012 to run a health policy dialogue, where we had policymakers from Ghana as well as informal workers coming together in Bangkok, as well as India and Thailand. But the interaction between the workers and the policymakers from Ghana was very heated in Bangkok, and they took it back to Ghana and carried on with a few more policy dialogues. And we sort of, eventually at the end of the policy dialogues, the National Health Insurance Scheme agreed to register 2,000 very poor headload porters, women who were being asked to pay urban level premiums, but who were in fact migrant laborers. And the NHIS agreed to do registration drives for them, come to their places of work, do the registration drives, and 2,000 people were registered. And the NHIS then went on to do a whole lot more registration schemes with the Kiai that got so inspired by the idea. So that's, one way these platforms can link. And with Pepanati Phase 2, I mean, we're still experimenting with Pepanati, but there are all sorts of linkages with national, occupational parts of the health system that we want to explore, especially with ergonomics specialists, occupational hygiene specialists. Another linking story is that there's a public health clinic in Warwick, but traders in Warwick can't access that clinic because they don't have proof of address for the inner city, okay? So now we've made contact with some of the public health officials. The point is now to negotiate, well, can they use their trader licenses to access the clinic instead? So these are some of the things. So, I mean, we're also learning, though. Part of the whole Warwick project is to dignify that workplace, that space, as a workplace by trying to introduce a system of health and safety that you find in a formal workplace, right? And so learning up from formal firms, from the private sector about how to do that is really important. And the other point is that we do need to connect with local governments, and local governments are really underfunded. With donor funding, it usually goes straight to national level. And if local government does need to be a partner, that's also something that needs to be addressed. Thank you.